So, this neg case was written by me in 20 minutes. Now, again, I know it's harder for you because you don't quite have the experience and it feels like you're blind in the dark right now. However, I mention this because A, nobody turned in a neg case, and B, you've got to just do it. So, you have to have your idea, then go make your argument. If you do that, you can create a case, not the perfect case, but don't let perfect be the enemy of the good, so that we can debate. And so, if everybody's ready, here's the neg case. U.S. President Woodrow Wilson once quipped, "If you want to upset someone, change something." Quite a number of voters were upset at the changes that were brought with the advent of Obamacare in 2008. Initially billed as an improvement over the status quo, Obamacare managed to ensure that the uninsured became insured through the creation of an individual mandate that forced everyone to pay for insurance. While that insurance definitely saved some individual lives, it also had massive issues that were unexpected and unpredicted at the time. Technical glitches beset the launch of Obamacare signups, and Americans were unable to access the website for months. Businesses faced new financial incentives and pushed millions of workers from full-time to part-time, and imposed a mandatory tax on those whose insurance was not covered by their employment. My point here is not to condemn Obamacare, but to point out that there will always be unpredicted consequences when you change something. It is because these changes will upset the majority of Americans that my partner and I negate the resolution. The United States should enact Medicare for All Act of 2019. I will negate the resolution with two contentions. First, that the Medicare for All Act destroys the private insurance industry, and secondly, that the time is not right for such a monumental change in our system. Let's begin with contention 1, which you can label Medicare for All destroys the private insurance industry. The Medicare for All Act of 2019 lowers healthcare outcomes by placing all Americans under a government-run healthcare system. The Committee for Economic Development, a nonpartisan think tank, points out that Medicare already suffers from massive cost overruns. The author attributes this to a mentality where the doctor is the hammer and every symptom is the nail. By trying out everything to solve the problems of their patients, doctors under the Medicare system end up trying every expensive procedure and then just let the government handle the bill. Doctors that know the patient has to pay for the care are more likely to explain the costs and benefits to the individuals, thus ridding themselves of expensive trial and error. When the costs are written off by the government, however, there's no need to have such delicate conversations. In fact, the same Committee for Economic Development article states that, quote, "Research has indicated there is considerable overtreatment and undertreatment as well, of course, in Medicaid. So cost overflows and quality suffers, but there is an alternative model according to this article. Under capitated prepayment, an integrated delivery system, in effect, an insurance company with its own team of doctors and facilities contracts to provide whatever services an enrollee needs for whatever conditions arise. There would be no billing for each individual service under such a model. Instead, the professionals in the system are paid by salary, and therefore they have no incentive to load on additional services regardless of any benefit to the patient, something that Medicaid already suffers from right now. But traditional Medicare was designed in a way that explicitly promotes fee-for-service medicine and discourages prepayment programs like the one I'm talking about. Specifically, Medicare guarantees that, quote, "any willing provider can participate." Capitated prepayment, in contrast, is typically built upon networks of selected physicians working as teams, which cannot be expanded to include any other physician selected at random. So there are fundamental reasons why Medicare is bound towards rapidly growing costs, most likely ultimately beyond the nation's capacity to afford. This alternative model that I just presented is a better option, but if you affirm the resolution, then you take it as well as other reasonable proposals, such as Medicaid for all that want them, off the table, and shove Medicare down everyone's throat. And that is a medicine that we are not going to enjoy taking, nor do many Americans want. The Democratic primary debates shed light on the largest union in Las Vegas, the Culinary Union. In 2018, the Culinary Union organized a strike to negotiate one of the strongest healthcare plans in the U.S. They gave up other benefits and risked their jobs in order to get the healthcare that they wanted for their family. Now, 2 years later, the enacting of Medicare for All, which my opponents want you to do, would rip that healthcare that they sacrificed for away from them. Worse, the only thing that they would get in exchange for it is worse government-run healthcare. Contention 2. Now is not the time. Enacting a new healthcare proposal needs to come at the right time for it to succeed. Today is not that day. We are less than 50 days away from a presidential election where healthcare is bound to be one of the most important issues. Enacting healthcare in the midst of this would deprive Americans of injecting their own input into that decision. This is something that we need to let the American people decide, and the opportunity is right in front of us. Moreover, enacting a bill championed by Vermont liberal Senator Bernie Sanders likely means that the Republicans, if they win again in 2020, will just work on ways to hinder the success of the program. Their desire to eliminate Obamacare has made signing up for the program exceedingly difficult. Without getting them on board to govern the law the way it's intended, does not set the law up to succeed. But that's just one reason why now's not the time. I alluded to this in Contention 1, but with a government-run system, there's no room for private insurance agencies. This means hundreds of thousands of Americans would lose their job in the midst of a pandemic. Americans would lose their insurance and have to learn a new system in the midst of the COVID pandemic. Doctors and offices would have to figure out entirely new billing measures and insurance forms at a time when they need all of their energy keeping us safe and healthy in the midst of a pandemic. The final reason that now is not the right time, however, is the cost. Contention 1 shows there are regular cost overruns in Medicare now. Those costs will only increase as the program increases. And the United States already massively added to its deficit, paying for the first stimulus. And there are hopes to helping families out with the second one, the odds of which decline considerably if lawmakers on Capitol Hill are suddenly worried about massive healthcare deficits as well. Even if the high estimates are not accurate, it only takes one side of the congressional aisle to change their budgeting plans based upon the estimates that they choose to believe. Thus, because Americans will receive worse care and now is the worst time to do it, I urge a negation of today's resolution. This is not the right time to upset the American healthcare system. And as Wilson said, all you get when you change something is upset citizens. Thank you.